Hello guys, I welcome all of you to today's FARMCAST. Today also we'll discuss 5 drugs of choice. Class of monoclonal antibodies against migraine. And as always, today also I'll discuss few questions or queries that you have asked me in the comment section, right? So let us begin with our drugs of choice, guys. The first one for today is neurocysticercosis. So all of you know, guys, this neurocysticercosis is the tissue form of T-solium, and for it the drug of choice is albendazole, right? But remember, for intestinal T-solium infection, albendazole is not effective. There we use praziquantel. But for tissue form where neurocysticercosis can be seen, in that case we use albendazole. But there is one slight more information here you need to remember. That is, whenever I start the patient on albendazole, then due to irritation, there can be seizure, right? So you have to be prepared for that. And second, in case of neurocysticercosis, there can be perilesional edema, right? So to decrease that, I use steroids like prednisolone. And in fact, before starting the patient on albendazole, we start the patient on steroids to decrease that perilesional edema as well as the risk of seizure that can be seen after I start the patient on albendazole. Overall, the drug of choice is albendazole, but if they ask you which is the first drug started, is it albendazole or steroids, then obviously your answer would be steroids, right? Moving on to the second disorder, NMS or neuroleptic malignant syndrome. Now guys, NMS has been asked a lot of times. A lot of times it has been asked. And if they ask you NMS, let me tell you a little bit about the cause. See, all of you know that neuroleptic malignant syndrome can be seen because of D2 receptor block. Typically, that is because of antipsychotics, and it is more with typical antipsychotics like haloperidol. And the risk is lesser with atypical antipsychotics, right? But maximum risk of neuroleptic malignant syndrome is with more potent typical antipsychotics like haloperidol, flufenazine. In atypical antipsychotics, the risk is more with some drugs like risperidone, which is a more potent at the D2 receptors, right? Now, the another part which is important and which you need to appreciate here is that it is not only D2 blockers like antipsychotics or even anti-emetic like metoclopramide can also cause NMS, but sudden withdrawal of a D2 agonist, right? Like D2 agonists like pramipexole or amantadine or levodopa even. So sudden withdrawal of drug that stimulate D2 receptor by any means can also cause NMS, right guys? So that is one thing you need to understand. Now for NMS, remember, the drug of choice is dantrolene, which is an inhibitor of RYR, ryanodine receptor, and dantrolene is also drug of choice for malignant hyperthermia. Nevertheless, if they ask you the most specific drug for NMS, then your answer won't be dantrolene. Because guys, remember one thing, most specific means acting just opposite to the cause. What is the cause here? D2 receptor block, right? What is the opposite? D2 receptor stimulation. So D2 receptor agonists like bromocriptine is the most specific drug for treatment of NMS. Alright guys, moving on to the next disorder, neutropenia. Now neutropenia can be because of disease like HIV, can be because of drugs like anti-cancer drug or any other drug, right, that causes bone marrow suppression. Now for these cases guys, the drug of choice, remember nowadays, is pegfilgrastim. Now you must have heard about filgrastim as well. The difference between pegilated or pegfilgrastim as compared to filgrastim is pegfilgrastim is longer acting, right? So I just need to give it one dose in a chemotherapy cycle. But if I'm using filgrastim, which is very short acting, I need to give multiple doses during the entire cycle. So for neutropenia guys, the drug of choice is pegfilgrastim or filgrastim, which is a GCSF, granulocyte colony stimulating factor analog. And one side effect you need to remember, this drug causes bone pain, right? Right, moving on to the next disorder guys, it is a side effect of a drug that is called as niacin-induced flushing. Now remember, the cause of niacin-induced flushing is induction of prostaglandin synthesis, right? So those prostaglandin, they cause vasodilatation that causes flushing. And that is the reason why the drug of choice has to be a prostaglandin synthesis inhibitor, that is NSAID and the NSAID of choice is aspirin. So niacin-induced flushing drug of choice is aspirin, right? Now guys, let us have a look at the last disorder for today. It is nicotine toxicity. Now guys, nicotine toxicity drug of choice is atropine, and sometimes students, they ask me a doubt, sir, why atropine? I mean, atropine is a muscarinic antagonist and nicotine acts upon nicotinic receptor. What is the rationale of using atropine in nicotine toxicity? So let me explain this to you. See guys, what nicotine does in the ganglions, right, of the parasympathetic nervous system is it stimulates NN receptors, and that increases release of acetylcholine in the post-ganglionic segment, and those acetylcholine in post-ganglionic segment will act upon your muscarinic receptor. So muscarinic symptoms are seen in nicotinic poisoning, and for those muscarinic symptoms I use atropine, right? Nevertheless, in nicotine poisoning there would be other symptoms as well. There would be seizure, for which we can use benzodiazepines and so on. So symptomatic management is also a part of nicotine toxicity, but overall the single best drug of choice is atropine. Alright, now let us move on to the second part of the PHARMCAST, where I discuss monoclonal antibodies, some of them. Right guys, today I'll discuss a new class of monoclonal antibodies that have cropped up in the last couple of years, and these are for migraine, and they are related to something called as CGRP, calcitonin gene related peptide. So this peptide acts upon receptor, CGRP receptor. So I can block either peptide or I can block either receptor. So if I block CGRP peptide itself or the ligand itself, then there are two drugs, and these are galcanezumab, GELCANEZUMAB, and fremanezumab, FREMANEZUMAB. So galcanezumab, fremanezumab are inhibitors of CGRP ligand, but there is an inhibitor of receptor, CGRP receptor, that is called as erenumab, ERENUMAB, right? So these drugs, they are used for prophylaxis of migraine, guys, right? So these drugs, sooner or later they will be asked in your exams. As of now, they have not yet made an appearances in any of your exams, but I'm pretty sure, right, these antibodies they will ask. Now what is the key to understand that these are the drugs that are acting on a disease from the neurological system? See, any monoclonal antibodies, if it is acting upon your nervous system, you will find these two alphabets NE, like galcanezumab NE, fremanezumab NE, erenumab N is there, right? So there will be NE or N, which directs us towards the nervous system. So you might not exactly get the use, but close to that, right? So these are the drugs used in migraine. Alright guys, so that's all from the section of monoclonal antibodies, and now let's have a look at the doubts that the students have asked, right? So one student has asked, and his is Sanat Patnaik. So Sanat Patnaik has asked, sir, I'm a second year student and I'm using Mero, and I've completed pharmacology and pathology, and can I start Rakesh sir and Rohan sir videos, or is it too early? See Sanat Patnaik, you are just in the second year, right? Apart from studies, I'll advise you to live your life, because these times they're never gonna come, and I would advise not to run ahead of your time. And if you are able to cover up those subjects which are entitled for a particular year, giving good enough amount of time, making your concept clear, then that is more than enough, I think, right? And you should give yourself some time for your life as well. You need to live your life, because believe me, this rat race and searching for your goal and working for it, it will continue your entire life. This is never gonna stop, right? But we should never stop living our life in between, right? So don't try to run ahead of yourself, and I would advise you that while you are moving ahead, try to make your fundamentals clear, right? Because you know that the next exam is gonna come, but nevertheless, you cannot answer a question of medicine or surgery entirely based upon the knowledge of medicine or surgery. The reason being, the foundation is built upon the pre-paraclinical subjects, so your foundation should be strong. So going ahead, right, if your physiology, pathology, pharmacology is strong, then automatically your medicine would be strong. You just need to add few points here and there of diagnostics, etc., of symptoms, and your medicine is ready, right? So you just try to integrate the preclinical subjects. Now try to integrate pathology, pharmacology, biochemistry, whatever subjects are there as of now, and moving ahead you can always build up upon that in medicine and surgery, right? Alright, so next question is asked by Lakshmi Prasanna. So Lakshmi has asked, Sir, how many questions I have to attempt in grand test? And if I attempt all the answers, attempt to answer all and leaving 1-2 questions, half of them becoming wrong, how to reduce these mistakes and improve the scores, how many questions we have to leave and to be on the safer side, please clarify. So, see Lakshmi, what you're asking me basically is how many questions should I attempt and how many questions should I leave. So let me tell you, there is no golden rule about it, right? But the thing is that you need to work out a formula for yourself, and this is one of the very important aspect of giving a grand test. So we give grand test to evaluate ourselves and to find a solution for ourselves, that how comfortable are we in attempting the questions. Should I be aggressive or should I be less aggressive? Should I be bullish or bearish while I attempt these questions? So on an average, if you would ask me for a good paper, right, 260 to 70 questions is on the safer side, because what I've seen is 20-30 questions, they are overboard and you have no idea about what's happening with those questions. So it is better to leave them aside. So all in all, if you look at a question in your exam, you know something about the disease, you know something about 1 or 2 options, you can rule them out, then you go for it. But if you look at a question and you have no idea what's happening in that question, right, you don't know if it is from the earth or from Mars, right, just leave it and be at peace. Right, this does not mean you'll leave 100 questions, because you'll be automatically out of race. So be aggressive in attempting like 260 to 70 minimum. The reason being, see, 30%, 40% questions out of those might get wrong, but overall if you see the marking, right, then you would still be on the positive side. So let me tell you, when you make a guess, it is an educated guess. You're not making guess out of the blue moon, out of anything just like that. You're able to make a guess because you have studied so much, right? So try to understand that. So because these are competitive exams and you need to be on your toes while answering these questions. Alright, so next question is Dr. Swati. Sir, I'm using Marrow test series and I'm giving all recent 2020 grand tests, but in Marrow many older grand tests are there, like in 2017 and 2018. Should I go for all those? See, again, I'm telling you guys, grand test is also a double-edged sword. Don't overdo, don't underdo. So I'll tell you, a neutral ground is 2 grand tests. A neutral ground is 2 grand tests in a month, right? So more can be counterproductive. Less, at least 1, I would say. It should not be 0. So at least 1 you should give, and maximum is 2 grand tests. And it depends upon you guys how your preparation is going. I mean, I think you should focus more on your notes and give 1 or 2 grand tests in a month. So I don't think, I mean, you should go back to the older grand tests. But if you have too much time and if you have revised all your notes, you're too confident and you just need to practice grand tests. It depends upon your priority, right, where you are at. Because there might be one student who is even struggling to finish the course as of now and thinking how can I begin the revision as soon as possible. For that student, it is not wise. But suppose you are a student who has already finished the course 1 month back, started already revising, and let us say you have finished 1 revision, and now you want to over attempt some more number of grand tests, then it's okay, you can go with that. So it depends upon where you are, Swati, right? So if you are struggling to even begin the revision and the time is less, then I would advise you to stick to 1 to 2 grand tests, right? If not, if you're too confident that you're prepared well, then you can go and attempt some grand test. Alright, so Sunaina Sheikh, she has asked, next question, Sunaina Sheikh has asked, sir, my GT score dropped by 10 questions. It is very disheartening. Is there any hope to improve now? Sunaina, nothing is lost. It's just 1 grand test, right? So guys, you have to learn to discount yourself, right? Because see, these grand tests, they differ a lot in the level of questions, in the, the amount of questions they ask from different topics. And that is why it's bound to happen that from one GT to another GT, your score will fluctuate. And this does not mean your preparation is jeopardized. Are you getting my point? So you need not worry. Don't take it too hard, right? So I've told you always that how much you're scoring in the GT is the last aspect. There are many more aspects that you need to see. That is there a topic that is being repeated frequently? And if I'm doing those questions repeatedly wrong, then I need to go back to that topic and see what is the problem, right? So these are the things you need to find out in GT. Another is how many questions I should attempt, right? Another is how am I supposed to give the grand test? How am I going to solve it? How many questions in the first layer, then second layer, then third layer? So these are the most important part of a grand test. How much you're scoring comes last. I'm not saying it is not important, but it comes at last, and which means one or two grand tests, you're not performing well, not the end of the world, believe me, right? You'll bounce back in another grand test. And I always tell you, the grand tests are always made on the difficult side, guys, to prepare you, right? To prepare you, they're always made on the difficult side. So for example, in your exam, if you have to climb 1000 meters, in your grand test, they ask you to climb 4000 or 5000 meters. So they're preparing, they're making you battle hardened, right? So that on the exam, you can perform well. So that is how it works. Are you getting my point? So don't worry, don't get disheartened. And what I've seen is mostly the last grand test that you give just before the exam, there is much more realistic, right, in parallel to the exam, that gives you a particular insight into how am I gonna perform in my exam. So that is more closer, right? And you will see that in that last grand test, your performance is gonna be super duper. All right, so coming to the next question asked by Ranjan Kumar Patel. He's asked, sir, FMG exam, foreign medical graduate examination questions, are they important for NEET PG? No, I don't think, Ranjan Kumar Patel, you don't need to go through those questions. And I mean, just to get a hang of what they're asking, you just can go through the NEET questions and AIMS questions. That will be more than enough. See, we would have huge resources, right? But we have to limit ourselves what to use, what not to use for our exams, because the biggest limiting factor that we have is time, right? So just practice the NEET PG questions, AIMS questions, and the Q bank or of any platform you are using, and you will be good to go. All right, coming to the next question. It is asked by Dhagash Sonpal. He's asked, so sir, I'm about to complete my first revision on 20th of October, but I still have my 150 modules from Q bank to complete. So earlier I decided to complete that in 10 days and then do second revision in 30 days of November. Now INI CET is on 20th of November. Should I start my second revision from 21st October itself so that I complete my second revision before INI CET? Or should I continue with Q bank? So I got a point. See, I have covered this earlier as well, right? That if you're serious about INI CET and you think you can get a good rank, then you can dedicatedly you can plan your revision according to INI CET, right? But if you're not so sure, but you want a seat at least in the NEET exam, right? Then in that case, I think you should focus on your syllabus considering NEET as the pattern. So it differs from students to students, right? So what is your priority? So if your priority is NEET, you can do that. Otherwise, here, I would not advise you to just solve the Q bank. No, see, don't make anything bolus, right? Make it a mixture. So start revising. Let us say start revising 6 to 7 hours your notes, and 3 to 4 hours just do the Q banks. So you should do solve questions every day and start revising. So if you have not done the Q bank, then there is no problem, right? But try to do it in a segregated way, because whenever we try to capture something, right, all of a sudden bolus ways in 10 days we give ourselves a hectic schedule, then our performance actually decreases. So take it bit by bit, step by step, and start your revision, and then do the Q bank as well. Now as far as INI CET is concerned, it depends upon what are your priorities. If you're too serious about it, you can plan according to that. If not, and if you're hoping that I just want one clinical seat in the NEET exam, then I think your all preparation should be focused based upon that. Yashashri Patel, sir, are there any changes in hospital waste management guidelines in COVID times? You see, Yashashri, you're asking the wrong person. Right, I have nothing to do with the hospital waste or the guidelines. So you should better ask the PSM faculty, right? Dr. Mukmohit or any other faculty you can ask, and they'll tell you about this. If you ask me about any drugs of COVID, I can tell you that. All right. Right, the next question has been asked by Ritu Ramba Sarkar. So Ritu Ramba Sarkar is asking, he's a batch of 2018 students, and overall it's a long doubt, but I'll just summarize it. So he's basically 2018 and he's scared about the NEET exam, next exam, as to how the questions are going to asked. Will they be assembly standards, or how the question will be? So Ritu Ramba Sarkar, see, remember, there are two ways, right? There are two ways we study. One way is we try to understand the subject, right? The basic concept, why thing is happening. Like in pharma, why a side effect is seen, or what is the mechanism of action, and how can I correlate to the mechanism of action to being why it is being used in a disease. So if your study is conceptual, you are trying to dig and find out those answers as to why and how in the medical science. then as long as you stick to concept, then does not matter what kind of exam you're giving in this world, USMLE, PLAB, NEET, NEXT, you'll always come out as a winner. But if you are focusing on just rote memory, that is, you are learning something and only if it is asked then you'll throw them back, right? That is not going to work in the coming times, because whatever questions they're going to ask now, you'll be able to answer after your detailed clinical analysis of those questions. So concept, way going forward, concepts are important. You need to understand things, not just mug up, right? So if you're understanding things and if you're being taught in a way which is making you more conceptualized and giving it a base, then you need not worry, right? If you're not just mugging up things, then it does not matter. Now, obviously, you're asking me, should I practice some USMLE pattern questions? So you can please go ahead. You can practice USMLE pattern questions. That is gonna help you, right? All right, guys. So that's all in the doubt section today. I've covered all your doubts, whichever you had asked. So that's all for today's session, guys. If you have any such kind of doubts or queries, you can always let me know in the comment box, and I'll try to cover them in one of the next FARMCAST. So take care. Bye bye. This is Dr. Ranjan with you.